These are the organs of the male reproductive system: vas deferens, prostate gland, penis, urethra, testis, scrotum, epididymis, bulborectal gland, and seminal vesicle. Testes. Those are male gonads which produce sex hormones and sperm. They are located within the scrotum, which lies outside the cavity of the abdomen. The test begins in the abdominal cavity but go down into the scrotal sacs during the last 2 months of fetal development. Epididymis. The epididymis is a long coiled tube which stores sperm and carries it from the testis. This occurs at the posterior margin of each testis and as a curved structure. Vasa deferentia. The purpose is to move sperm from the epididymis to the ejaculatory ducts for ejaculation development. The tissue lining the inner walls is a moist and folded mucous membrane. There are 3 layers of circular and longitudinal muscle fibers which surround the mucous membrane. Seminal vesicles are 2 tiny glands at the base of the bladder, which stores and produce much of the semen-forming fluid. Prostate gland is a small gland covering the upper part of the urethra, the main function of which is to secrete prostate fluid, one of the components of the semen. Its muscles also help in propelling the seminal fluid through the urethra during ejaculation. Urethra is the tube transporting urine from the bladder to the outside of the body. For males, when the man achieves orgasm, the additional role of ejaculating semen is this. Bulborectal glands, pea-shaped glands in the male, located at the beginning of the inner portion of the penis under the prostate gland. They add fluids to the semen during the ejaculation process. Penis is a sexual intercourse in the male organ. This has a long shaft and an extended tip called the gland penis, which is covered by a layer of prepuce at birth. It delivers sperm into the female reproductive tract. Scrotum is a loose pouch-like skin pocket hanging behind the penis, holding the testicles, helps control the temperature of the testes by keeping them closer to the body or further away. Pathway of sperm. Testes are where sperm is produced. The epididymis is a long coiled structure above the testes, and it collects and stores immature sperm from the testes as they mature. When ejaculation happens, sperm is immediately expelled from the tail of the epididymis into the vas deferens. Sperm then passes up the sperm cord through the vas deferens. The vas deferens here joins the seminal vesicle from the ejaculatory duct, passing through the prostate and emptying into the urethra.
GnRH, gonadotropin releasing hormone. Source: it is produced in the hypothalamus. Function: gonadotropin releasing hormone is a releasing hormone responsible for the release of follicle stimulating hormone FSH and luteinizing hormone LH from the anterior pituitary. FSH, follicle stimulating hormone. Source: it is synthesized and emitted by gonadotropic cells from the foremost piece of the pituitary organ. Function: stimulates testicular growth and upgrades the production of an androgen-restricting protein by the Sertoli cells, which are part of testicular tubule, fundamental for continuing developing sperm. LH, luteinizing hormone. Source: is produced in the anterior pituitary gland. Function: stimulates testosterone by release the leading cells of pituitary. Testosterone. Source: gonads. Function: testosterone plays a key role in the development of male reproductive tissues, such as testes and prostate, as well as promoting secondary sexual characters such as increased muscle and bone mass, and the growth of body hair.
We can see in the diagram, it all starts in the hypothalamus where GnRH hormone is produced. Then it goes to the pituitary glands where it can become LH or FSH hormones. After this, they move to the testes and it becomes testosterone.
These are the organs of the female reproductive system: ovary, cervix, rectum, vagina, hymen, labia minora, labia majora, clitoris, urethra, bladder, uterus, and fallopian tube. The external female genitals are collectively known as the vulva, and its components are the labia majora, labia minora, the glans clitoris, and a cleft with the openings of the urethra and vagina. Ovaries are located one of each side of the upper pelvis. Ovaries have three functions: 1. Shelter and protect the eggs. 2. The produce of female reproductive hormones, estrogen and progesterone. 3. Ovulation. Oviducts. Ducts are located in the human female abdominal cavity. Its functions are to transport the male sperm cells to the egg, provide a suitable status for fertilization, and transport the egg from the ovary. Uterus. Muscular organ located between the bladder and the rectum. Its functions are to nourish and protect a fertilized egg until the fetus is ready. Vagina. Elastic muscular canal with a soft, flexible lining that produces lubrication and sensation. Its functions are sexual intercourse, serves as a conduit for menstrual flow from the uterus, and giving birth. Labia majora. Pair of rounded folds of skin and adipose that are part of the external female genitalia. Its function is to cover and protect the inner part, more delicate and sensitive structures of the vulva. Labia minora. Pair of thin cutaneous folds that are part of the vulva or external female genitalia. They serve as protective structures that surround the clitoris, urinary orifice, and vaginal orifice. Glans clitoris. Erectile structure and it's homologous to the penis, means that it develops from the same structures and has similar properties. The only function the clitoris has is to serve as site of erotic sensation. Cleft with the openings of the urethra and vagina. The vagina may be partially closed by a tissue called the hymen, which is ruptured by sexual intercourse or some other physical means. Fertilization occurs in the fallopian tubes. It happens when a sperm cell meets with an egg in the fallopian tube. When fertilization happens, the fertilized cell is called zygote. This cell will move down the fallopian tube and in the uterus. When the zygote is into the uterus lining, it's called implantation. Then where the zygote implants, it's called blastocyst. Then turns into a fetus since the uterus lining fits the blastocyst. The ovaries produce the egg cells, named oocytes. These are transported to the fallopian tube where it can occur fertilization by sperm. The previous fertilized egg transports to the uterus. Once it arrives to the uterus, the egg can implant into the uterine lining and continue expanding. The ovarian cycle is divided into three: the follicular phase, ovulation, and the luteal phase. Follicular phase. The FSH released by pituitary gland stimulates the development of a follicle in one of the ovaries. While the follicle matures, oogenesis begins. As estrogen level rises, negative feedback stops the secretion of FSH, so this way the follicular phase ends. Ovulation. The estrogen causes the secretion of GnRH from the hypothalamus, which causes a surge of LH from the past pituitary gland. Ovulation comes from the secondary oocyte from the follicle and into the oviduct. Luteal phase. LH promotes the development of corpus luteum that consists of the follicle cells left behind after ovulation. It also secretes female sex hormones, mainly progesterone. The uterine cycle. The uterine cycle can be divided into three parts: menstruation,
proliferative phase, and the secretory phase. Menstruation. It could last from 1 day to 5 days. It consists of the breakdown of the endometrium with the blood going through the vagina. Proliferative phase. It occurs from day 6 through 13 and consists of the buildup of endometrium. This phase is caused by the production of estrogen by the new developing follicle. Secretory phase. It happens from day 15 to 28. It consists of endometrium doubling in thickness and uterine glands producing a thick mucus secretion. The secretory phase is caused by the secretion of progesterone by the corpus luteum. Later this, the endometrium is already prepared for receiving an embryo. The ovarian cycle controls the preparation of endocrine tissues and release of eggs, while the menstrual cycle controls the preparation and maintenance of the uterine lining. These cycles occur concurrently and are coordinated over 22 to 32 day cycle with an average length of 28 days. GnRH. The source is hypothalamus. The function, it causes the pituitary gland in the brain to make and secrete the LH and FSH, cause the ovaries to make estrogen and progesterone. The control in the GnIH neurons are regulators of GnRH secretion. FSH. The source is hypophysis. The function is to regulate the reproductive cycle in both sexes. In women, it stimulates the development of ovarian follicles and regulates the menstrual cycle. The control is by feedback due to the action of sex steroids and other hormones on the pituitary gland. LH. The source is hypophysis. In the function in women, increased LH triggers ovulation. This hormone is also part of the regulation of the menstrual cycle and is essential for reproduction. The control LH, like FSH, is controlled by feedback due to the action of sex steroids and other hormones on the pituitary gland. Estrogen. The source is ovaries and the adrenal glands. The function develops secondary female sexual characteristics, the growing of breasts, the appearance of menstruation, and the widening of hips. It's controlled by GnRH. Progesterone. The source. From ovaries, the adrenal glands, and during pregnancy from the placenta. The function. Sex hormone released by the ovaries and later the placenta. In the menstrual cycle, conditions the endometrium to facilitate the implantation of the embryo in it, and in pregnancy helps make it safely. Control. The formation of the corpus luteum, which produces the majority of progesterone, is triggered by a surge in luteinizing hormone production by the anterior pituitary gland. Contraceptive pill. The birth control pill works by stopping sperm from joining an egg, which is called fertilization. No ovulation means there's no egg hanging around for sperm to fertilize, so pregnancy can happen. Procedure. Take one every day for 21 days. Then stop for 7 days, and during this week you have a period type bleed. You start taking the pill again after 7 days. You need to take the pill around the same time every day. The pill is 99.7% effective with the perfect use. The pill can increase the risk of cardiovascular problems such as blood clots, deep vein thrombosis, etc. Male condom. Condoms are the only type of contraception that can both prevent pregnancy and protect against sexually transmitted infections. Procedure. Work by keeping semen, the fluid that contains sperm, from entering the vagina. Male condoms are 98% effective. Risks. Some people may be allergic to latex, plastic, or spermicides. Condom breakage and slippage decrease effectiveness. Vasectomy is a surgery that means to protect against pregnancy permanently. Vasectomies are almost 100% effective at preventing pregnancy. A vasectomy does not protect you from getting or passing on any sexually transmitted disease. Procedure. The male vasa differentia are cut and tied or sealed so as to prevent sperm from entering into the urethra and thereby prevent fertilization of a female through sexual intercourse. Risks: bleeding or blood clot inside the scrotum, blood in your semen, bruising of your scrotum. Diaphragm procedure is placed inside the vagina and it prevents pregnancy by creating a barrier between a woman's uterus and a man's sperm. It has to be in place for 3 hours or more before you have sex. A diaphragm or cap is 92-96% effective at preventing pregnancy. The diaphragm does not protect against STDs. Risks: spermicide applied to the diaphragm may damage the cells lining the vagina, causing increased risk of contracting STI. Intrauterine device (IUD), shaped like a D and a bit bigger than a quarter. An IUD fits inside your uterus. It prevents pregnancy by stopping sperm from reaching and fertilizing eggs. IUDs are one of the best birth control methods out there, more than 90% effective. It doesn't protect against STDs. Procedure: the nurse or the doctor will put a speculum into your vagina and then use a special inserter to put the IUD in through the opening of your cervix and into your uterus. Risks: menstrual problems, perforation. The IUD may get stuck or perforate the uterus. Expulsion.
Female condom. Female condoms are made from soft, thin, synthetic latex or latex. They're worn inside the vagina to prevent semen getting to the womb. If used correctly, female condoms are 95% effective. They protect against pregnancy and sexual transmitted infection. Procedure: squeeze the ring at the closed end of the pouch with your middle finger and thumb and insert it into your vagina like a tampon. Place your index finger inside the condom and push the ring in as far as it will go. Risks: it has higher failure approximately 21%. The outer ring may be considered cumbersome. Contraceptive implant is a tiny, thin rod about the size of a matchstick. It doesn't protect against STDs. The implant is over 99% effective. Procedure: a doctor inserts the implant under the skin of your upper arm. It releases the hormone progestin to stop you from getting pregnant. Risks: abdominal or back pain, and increased risk of non-cancerous ovarian cyst. Contraceptive patch is a safe, simple, and affordable method that can be worn in the skin of the belly, upper arm, or back. The patch is more than 99% effective at preventing pregnancy, but it does not protect against sexually transmitted infections. Procedure: the patch releases a daily dose of hormones through the skin into the bloodstream to prevent pregnancy. It contains the same hormones as the combined pill and works in the same way by preventing the release of an egg each month. Ovulation. Risks: soreness in the skin where the patch is, bleeding between periods. Tubal ligation. Tubal ligation is one of the most commonly used surgical sterilization procedures for women. This is really great at preventing pregnancy, more than 99% effective, but it won't protect you or your partner from sexually transmitted infections. Procedure: is a type of permanent birth control. During tubular ligation, the fallopian tubes are cut, tied, or blocked to permanently prevent pregnancy. Risks: damage to the bowel, bladder, or major blood vessels, improper wound healing, or infection. Vaginal ring is a small, soft plastic ring that you place inside the vagina. If used correctly, the vagina ring is more than 99% effective, but it doesn't protect against sexually transmitted infections. Procedure: the ring steadily releases the hormones estrogen and progesterone into your bloodstream, which prevents the release of an egg each month. It also thickens the cervical mucus, which makes it more difficult for sperm to move through the cervix. Risks: vaginal infections and irritation, vaginal itching or discharge, nausea.